For the past 37 years, DMR has been creating mobility solutions such as custom wheelchairs for people who need it and maybe even someone you love. Angel, the president of DMR, is waiting for us inside to tell us more about it. Let's go meet him. Angel, walk me through the process of receiving mobility assistance and how you take care of your customer.
Basically what we do is we personalize it to the individual consumer's needs. The first part would be an intake process from our customer service, making sure that they have the appropriate diagnosis for what we call a complex wheelchair, or Medicare calls it a Group 3, which means it has three most important seat functions: tilt, recline, and power legs. After we determine they qualify for the wheelchair, we would schedule them with a doctor, which is known as the face-to-face evaluation by a doctor. They meet with the doctor does his evaluation. He then refers it to a therapist who does what they call a specialty evaluation. It has to be a PT or OT. After that, we put all the paperwork together. We submit it for prior authorization through Medicare. Once we get an authorization, then we order the wheelchair based on the measurements I took in the evaluation. Once we receive it, we custom assemble it with all the components, and then we schedule delivery and a fitting where we adjust it to the consumer's individual needs.
And who is your consumer?
Our consumer would be anybody that has a diagnosis such as CVA, stroke, Parkinson's. It has to be a neurological condition.
What sort of insurance do you accept?
We accept open access Medicare and Medicaid, not affiliated with an HMO or any private insurance company that will give us a prior authorization.
What separates you from, say, someone else?
Well, the difference between us and somebody else is we're probably the only family-owned and operated assistive technology or custom wheelchair provider in South Florida.
Now, during COVID, it seems that everything has gotten more complicated. How has that affected you?
Well, it's actually, we've adjusted for it. I mean, obviously, I would have a mask and a face shield when I meet with the patient, and gloves, but we use telemedicine, which is now a new norm. If they don't feel comfortable going into the doctor's office, or there was a time when the doctor's offices were actually closed down, we would actually have the patient come here, or we would go out to the home and do telemedicine. And the same is true with the physical therapy evaluation.
Right, yeah, you at home may have enough stress going on in your life. The last thing you need is something else to worry about, and you take a lot of that worry away.
Correct.
All right, well, thank you so much for your time.
Thank you.
Mm-hmm.